Thank you for your invitation. I'm very happy to share with you my experience about latissimus dorsi transfer. With reverse prosthesis, the first to develop this technique was Christian Gerber in 2002 and 2005. He used basic lepiscopo technique with two incision, one in axillary part and one on the acromion, and this technique was described in first by lepiscopo for the birth palsy, obstetrical palsy in 1934, but in its first publication he just transfers the teres major and he cut the latissimus dorsi. He modified his technique in 1939 and parallelly Merle d'Aubigné modified the initial technique from lepiscopo and use only one portal, anterior portal, dictopectoral approach. And Pascal Boileau used this technique from 2004, and he described in 2009 33 cases with this technique. You see the two different techniques with two incisions. It was described for the cuff repair by Resch, and secondary by Enrico Gervasi, and the single incision is a draw from Merle d'Aubigné. The good indication for the reverse shoulder arthroplasty is arthropathy is excentered arthritis with a pseudo-paralytic aspect, and without result of the medical treatment. And you need to check the external rotation in position 0 and in abduction. It's a bugle sign and the like sign. It's very important to check it. A single incision technique is certainly the easier technique because you don't have exploration into the axillary area with the high risk of infection with the Cutibacterium acnes. In this technique, you grasp latissimus dorsi and teres major in the same time, and you prepare the two tendons, and you fix the two tendons in the same place on the humeral side, but you pass the two tendons around laterally, externally, around the humeral shaft, and you restore like this the external rotation. You need to repair the pectoralis major because it's the most important point for the stability of the shoulder, because very frequently you don't have any subscapularis tendon. Subscapularis tendon has totally disappeared. It's a technical point. You see the incision, you see the pec major, and after the section of the pec major, you see the tendon of latissimus dorsi on the right, and just behind is the teres major. You can pass the suture along of the tendon of latissimus dorsi and teres major. Actually, I use the tape because it's strong enough, definitively strong enough, and you pass the two tendons around the humeral shaft. You must be safe regarding the radial nerve. You don't damage it, and the axillary nerve too. And you make two holes into the bone, and I use a pec major button to fix the two tapes onto the bone. I pass the two buttons before, and after I insert the stem of the prosthesis, and after that, when I reduce the prosthesis in the right position, and I finish to tie the suture of the tendon transfer in external rotation, just 45 degrees on external rotation to don't restrict the internal rotation. And after that, you can use the same suture to refix again the pec major, like described Merleau-Bignet in 1947. And after 6 months, you can see the result. It's be used with stemless reverse prosthesis, but I mean it's not a very good option with the stem. It's definitively better because you can break the upper part of the humerus with a true hole for reinsert two tendons. You see the final result after 6 months, and you see it's very long to obtain the final result, and 9 months it's a very good option. You see some result and the good quality of external rotation after this procedure. With stem prosthesis, stem-head prosthesis, you can use a small plate, very low profile, and you see it works very well, and you can use cement if you want. But you need to remember all muscle you have transferred, the lost some power, and two stage at the minimum, and you need to select the good indication of the muscle transfer. Single incision is definitively the best way to have a good efficiency of the procedure. And I mean, mini button is definitively stronger than transosseous suture, because with the transosseous suture, especially if you cement the stem of the prosthesis, you can have some problem and you can lose the benefit of the muscle transfer. Thank you for your attention.